Memories are an integral part of who we are, but as we get older our memory declines. For many older adults, the decline becomes so serious that they are no longer able to live on their own. However, scientists have been learning more about our brain's ability to change and grow new neural connections each day, even in old age. Although there are no guarantees when it comes to preventing memory loss or dementia, certain activities might help. Consider these simple tips to enhance your memory and delay memory loss. Eat a healthy brain-boosting diet. A healthy diet might be as good for your body as it is for your brain. Eat fruits, vegetables, whole grains and low-fat protein sources. The following nutritional tips will help improve your brain power and reduce your risk of memory loss. Consume more of these. Omega-3 fatty acid-rich products. Research shows that omega-3 fatty acids are particularly beneficial for brain health, relieving stress and anxiety. Fish is a particularly rich source of omega-3 fatty acids, especially fatty fish such as salmon and tuna. Many studies have shown that consuming fish and fish oil supplements may improve learning and memory and have been shown to delay cognitive decline especially in older people. Fruits and vegetables. Fruits and vegetables are packed with antioxidants, which are substances that protect your brain cells from damage. Colorful fruits and vegetables are particularly good antioxidant sources. Green tea. Green tea contains polyphenols, powerful antioxidants that protect against free radicals that can damage brain cells. Among many other benefits, regular consumption of green tea may enhance memory and mental alertness and slow brain aging. Water. Water acts as a shock absorber for the brain and spinal cord. It helps our brain cells use nutrients. Just a small amount of dehydration can have disastrous effects on the brain. Mild dehydration has been shown to cause brain shrinkage and memory impairment. Aim for at least 8 to 10 glasses of water per day or more if you're very active. Curcumin. Curcumin is one of a category of compounds called polyphenols, a potent antioxidant that exerts powerful anti-inflammatory effects in the body. Multiple studies have found that curcumin reduces oxidative damage and inflammation in the brain and also lowers the brain cell and tissue death. Dark chocolate. Eating dark chocolate improves a person's memory. The results of a 2011 study suggest that flavonoids, which are the active compounds in chocolate, help boost brain function. People who ate dark chocolate performed better on spatial memory tests than those who did not. Consume less of these. Saturated fat. Research shows that diets high in saturated fat, from sources such as red meat, butter and cheese, increase your risk of dementia and impair concentration and memory. Added sugar. Eating too much added sugar has been linked to many health issues and chronic diseases, including cognitive decline. Research has shown that added sugar can lead to poor memory and reduced brain volume, particularly in the area of the brain that stores short-term memory. Refined carbohydrates. Consuming large amounts of refined carbohydrates like cakes and cookies may be damaging to your memory. These foods have a high glycemic index, meaning the body digests these carbohydrates quickly, leading to a spike in blood sugar levels. Coffee. Coffee has actually been shown to enhance memory by providing a powerful dose of antioxidants called flavonoids. But having too much or consuming it later in the day can have the opposite effect as it can impair with sleep in sensitive individuals, which in turn impair with memory consolidation. Physical activity or exercise. Physical activity is important for overall physical and mental health as it increases oxygen and blood flow to your whole body, including your brain. This might help keep your memory sharp. Research has established that it's beneficial for the brain and may help improve memory in people of all ages. Many studies have shown exercise may increase the secretion of neuroprotective proteins and improve the growth and development of neurons, leading to improved brain health. Regular exercise in midlife is also associated with a decreased risk of developing dementia later in life. For most healthy adults, at least 150 minutes a week of moderate aerobic activity is recommended, preferably spread throughout the week. Get enough sleep. Sleep deprivation has been associated with poor memory. Make getting enough sleep a priority. Most adults need 7 to 9 hours of sleep a day. Sleep plays an important role in memory consolidation, a process in which short-term memories are strengthened and transformed into long-lasting memories, with the key memory-enhancing activity occurring during the deepest stages of sleep. Research shows that if you are sleep-deprived, you could be negatively impacting your memory. Get on a regular sleep schedule. Go to bed at the same time every night and get up at the same time each morning. Try not to break your routine, even on weekends and holidays. Manage chronic health problems. There are many diseases, mental health disorders, and medications that can interfere with memory. These include heart disease, and its risk factors have been linked to mild cognitive impairment. Diabetes. Studies show that people with diabetes experience far greater cognitive decline than those who don't suffer from the disease. Hormone imbalance. Women going through menopause often experience memory problems when their estrogen declines. Medications. Many prescriptions can get in the way of memory and clear thinking, including cold and allergy medications, sleep aids, and antidepressants. Talk to your doctor or pharmacist about possible side effects. Depression. Mental sluggishness, difficulty concentrating, and forgetfulness are common symptoms of depression. Once the depression is treated, memory should return to normal. Meditate and practice yoga. The practice of meditation may positively affect your health in many ways. It has been found to reduce stress and pain, lower blood pressure, improve memory in people of all ages, and increase gray matter in the brain which decline as you age, by rewiring the brain and encourage more connections between brain cells. Studies also show that meditation helps improve several cognitive functions, like focus, concentration, memory, and learning. One study found that yoga significantly improves speed and accuracy on memory tests. It also emphasizes breathing from the diaphragm, which helps maximize our oxygen intake, thus improving mental function. Maintain a healthy weight. Maintaining a healthy body weight is essential for well-being and is one of the best ways to keep your body and mind in top condition. Several studies have established obesity as a risk factor for cognitive decline. Being obese can actually cause changes to memory-associated genes in the brain and is also associated with a higher risk of developing Alzheimer's disease. Obesity can also lead to insulin resistance and inflammation, both of which can negatively impact the brain. Manage stress. When you're stressed, your body releases stress hormones like cortisol. Cortisol has been shown to greatly impair the brain's memory process, especially our ability to retrieve long-term memories. Over time, chronic stress destroys brain cells and damages the hippocampus, the region of the brain involved in the formation of new memories and the retrieval of old ones. Manage stress by setting realistic expectations, taking breaks throughout the day, expressing your feelings instead of keeping them inside, setting a healthy balance between work and leisure time, focusing on one task at a time. Avoid bright screens before bed. Avoid all screens for at least an hour before bed. The blue light emitted by cell phone, TV, and computer screens trigger wakefulness and inhibits the production of melatonin, a hormone that controls your sleep-wake cycle. A poorly regulated sleep cycle can really take a toll on sleep quality. Without enough sleep and rest, the neurons in our brain become overworked. They can no longer coordinate information, making it more difficult to access memories. Roughly an hour before bedtime, turn off your devices and allow your brain to unwind. Know your vitamin D levels. Vitamin D is an important nutrient that plays many vital roles in the body. Low levels of vitamin D have been linked to a host of health issues, including a reduction in cognitive function. Low levels of vitamin D have also been linked to a greater risk of developing dementia. Speak with your doctor about getting a blood test to find out if you need a vitamin D supplement. Enjoy nature. Getting out into nature is incredibly important for our emotional and physical health. Enjoying nature can even be considered a form of meditation. One study found that a walk in a park improved memory and attention compared to walking in a city. Likewise, Daily gardening lowers your risk of dementia by 36%, according to another study.